Good afternoon, everyone. Again, this is Nirav Shah from the Maine CDC. We're being joined by Governor Mills right now. Governor, the floor is yours. And Governor, you're on mute before you dive in.
Thank you, Dr. Shah, and welcome to a beautiful Maine afternoon. I will welcome Dr. Shah to provide his daily update in just a moment, but I wanted to share a little bit of news first with those watching. Earlier this month, our administration announced our Keep Maine Healthy plan, which aims to protect the health of Maine people and visitors both, while allowing people to visit Maine and to support Maine's small businesses during the summer months. A cornerstone of that plan is to support towns and cities across Maine. They're on the front lines responding to COVID-19, and they're in the best position to protect residents, to protect staff, working men and women, and to protect visitors during the upcoming tourist season. So knowing that the towns and cities are a critical partner in the fight against COVID-19, we've been working with Maine Municipal Association to dedicate some federal funding for municipalities to develop what we're calling COVID-19 prevention and protection plans. Now, municipalities across Maine have been submitting plans to us, and we're ready to make the announcement that we've approved COVID-19 prevention and protection plans for 96 towns and cities across the state, amounting to about $9 million of federal funding. Each of these plans is unique, but each one of them is targeted to the town's individual needs and experiences, their expected influx of tourists and visitors, and their experiences with COVID-19 and their public health readiness. But each plan includes at least one of the following components: public education activities, such as printing and posting COVID-19 prevention information. 2, physical distancing and public health support, like taping off measurements, 6-foot measurements, and where there might be lines, and signage for physical distancing in public spaces and in closed streets that weren't always closed. Providing staff to limit crowds in front of restaurants, bars, and beaches and other sites where people might gather. Some new traffic pattern signage and education about new traffic patterns. Or purchasing PPE, personal protective equipment, and hand sanitizer to make them available for staff and visitors and for use at public locations. Extra cleaning supplies and additional staff time required for enhanced cleaning and the management of public spaces and restroom facilities. And third grouping is local business assistance, such as staff time for a code enforcement officer or a local health officer. Every town has a local health officer, and pretty much every town has a code enforcement officer. So additional staff time for one of them or someone designated by them, who would be the local contact person for educating businesses on best practices and following up on any public complaints. These municipal programs vary in size and scope. For example, the town of Kittery, we've awarded them almost $250,000 for a comprehensive campaign to promote and support public health measures among residents, businesses, and visitors, including providing additional contact-free services in public spaces like parks, marinas, and municipal buildings. Their grant will support educational materials and training and sanitation supplies and hiring a seasonal code enforcement staff person to assist with inspections, to respond to complaints, and to do random compliance checks of physical distancing, occupancy, and sanitation at businesses. In Bangor, they're using their grant to promote Mask Up For Me campaigns. And in Bar Harbor, they're using their grant to support public health best practices, including enhanced signage, public kiosks with free facial coverings and sanitizer for visitors, and a parklet program to support efforts to bring indoor businesses outside. I applaud these towns and cities and welcome the partnership of our local communities in this effort. Right now, Maine, adjusted for population, Maine ranks 7th lowest in the nation in terms of positive cases. We rank 9th in the nation, 9th lowest in the nation in terms of deaths. We are 6th lowest in the nation in terms of patients ever hospitalized out of the 36 states reporting. And we are 5th highest in the percentage of people who recovered out of the 42 states reporting. Those numbers are so encouraging, but we can't let down our guard. These numbers are just not only numbers, they are the product of all of our collective efforts across the state. But as we reopen a vast majority of our economy and our businesses, as many more people interact and as many more visitors arrive from out of state, which we want them to do, the likelihood of the virus spreading also increases. So we need to be ever more vigilant. These awards we're making to towns and cities across Maine are a deliberate attempt to help mitigate the danger by helping municipalities implement measures that will protect the health of residents, staff, and visitors alike. You know, we're seeing record high case counts in other states like Texas and Florida right now. The experience of those states should be a cautionary tale for us. COVID-19 is not gone. The pandemic is not over. We are not immune from what we're seeing happening in other states. We have to remain vigilant, all of us. And we must continue to protect ourselves and protect one another if we want to reopen our economy safely and if we can limit the dangerous spread of this life-threatening virus. I think we can do that. I know we can do it. I'm pleased with the results so far, but it takes every one of us doing the right thing for ourselves and our family and our neighbors and friends. So I'm delighted to report this news and to bring into the fold the towns and cities across Maine who are so excited, enthusiastic about helping us monitor the conditions in the communities, be our eyes and ears, and be an educational effort, be ambassadors for the public health community in Maine to spread the word to businesses and staff and visitors and tourists who we want to come here in the coming months. Commissioner Lambrew is also here and may also be able to answer any questions you have about these grants. And before that, I will turn things back over to Dr. Shah. Thank you.
Great. Thank you very much, Governor. Before we turn to questions, I'd like to just provide a quick snapshot of where things stand on the COVID-19 front from a public health and epidemiology standpoint. As of this morning, Maine CDC is reporting 3,102 cases of COVID-19 across the state, representing an increase of 32 cases since yesterday. Of those, 2,758 are confirmed and 344 are probable cases. Right now in Maine, 28 individuals are currently in the hospital. 9 of them are in the ICU and 6 are on ventilators. Overall, there have been 103 individuals who have passed away with COVID-19 in Maine and 2,542 who have recovered, an increase of 32 recoveries as well since yesterday. One important note, we've talked a lot about the number of healthcare workers. Right now in Maine, of our cases, 787 are among healthcare workers. But a number that I haven't provided previously is the number of healthcare workers who have themselves been released from isolation and been classified as recovered. That number is 680. Of our 787 healthcare workers, 680 have recovered and been released from isolation. Overall, Maine CDC has now fielded 9,500 requests for consultation from healthcare providers and healthcare institutions across the state. A few updates on some of the outbreaks and work that we've been doing across the state. The first is in connection with a community-wide testing initiative that we set up in the Houlton area after a number of individuals associated with the Houlton ambulance service tested positive. I'm pleased to report that over the last first part of this week, Maine CDC worked with our colleagues at the Houlton Regional Hospital. They collected 300 samples from members of the community in and around Houlton. All the results have come back, and of those 301 samples in total, just 1 was positive. This is good news. We are following up with the individual who has tested positive to undertake our standard contact tracing process. But I'd like to first offer my heartfelt thanks to the entire team at Holton Regional Hospital. In a matter of about 36 hours, they went from hearing about what was going on to being ready, willing, and able to stand up this community-wide testing site in the parking lot of their hospital. I commend them for their quick action. We could not have accomplished this without them. So on behalf of the entire team here, we thank everyone at Holton Regional Hospital. This episode in Holton is also a reminder that the virus can travel wherever people can travel to. No part of the state is immune from the possibility of having cases of COVID-19, as Governor Mills just noted. I'd like to provide a quick update on where things stand on the testing front across the state. I'd like to provide an update on the activities around testing yesterday, over the past 7 days, and then cumulatively. Just yesterday in Maine alone, there were 2,225 PCR-based tests that were run on individuals across the state. Of those tests, 39 were positive, bringing yesterday's one-day positivity rate to 1.75%, well below the 2% threshold. On a 7-day weighted moving average basis, that brings our 7-day positivity rate to 1.8%. Again, also a good margin under the 2% basis. Also yesterday, for the first time, our cumulative positivity rate. This is the rate for every single test done since the beginning of COVID-19 testing in Maine. That cumulative positivity rate dipped below 4% for the first time yesterday. That represents a positivity rate based on 89,264 PCR tests conducted across the state of Maine. As we've talked about at these meetings, we are headed in the right direction, but we still have to keep both of our feet on the gas to expand and increase the amount of testing available. Before we go to our colleagues in the media, Commissioner Lambrew, is there anything on your end? Okay, in that case, we will turn to the media colleagues. And today's first question goes to Amy Brown from WERU.
Thank you, Dr. Shah. Do you have any further updates on the situation in Castine and whether, as you're investigating, you have learned if the people involved had been violating any of the governor's orders and if they were wearing face coverings and so forth?
Sure, Amy. So our investigation into the situation in Castine is still very much underway. We've had regular communication with local officials in that area about where things stand and what we know as we've been gathering facts. As of this morning, there have been no confirmed cases among Maine residents in the Castine area, although, again, we are working very closely with local officials and healthcare entities there. Now, with specific respect to the individuals who were here, again, we are investigating where they came in from, what the nature of their activities was, and whether there were any violations at all. That's going to be part of not just the public health investigation, but the broader investigation as we move forward. As we have updates to that, we'll make sure we update everyone here.
Thank you. And I think both for you and the governor, whoever wants to weigh in on this, with the extreme surges being seen in other states following reopening, what does Maine have in place that those states don't that's going to prevent us from going in the same direction?
I can start by saying we have several things in place that are intended to protect us against such a surge, assuming people comply and cooperate as they have to date. We have a 50-person gathering limit, which means there should not be large congregations in concert halls, in banquet venues and that kind of thing, or outside or inside. And we still have, we think, a very good public health measure, which says if you come from other states other than New Hampshire and Vermont, you should either quarantine for 14 days or have a test within 72 hours before you come here. I see no reason why a person shouldn't want to get a test. You know, what's the harm in getting tested? We know that tests are now more widely available in other states as well as the state of Maine, more widely available than ever before. And the standing order that our state and several dozen other states have, will help people get tested for their own good. Know before you go. That's what we're promoting. Know before you go. So we have those measures in place, as well as obviously pretty detailed compliance measures and checklists for all kinds of businesses, starting soon for things like bowling alleys and amusement, indoor and outdoor amusement facilities, hotels, restaurants, all of the above. We're still not opening indoor bars. And you can see that in Texas now, Governor Abbott has now closed bars. In Florida, we hear a lot from people in Florida who want to travel here. They're free to do that, but with that huge outbreak, more than 9,000 new cases yesterday alone, we expect them to test before they come here. And in Florida, the Governor DeSantis, just imposed a limitation on bars where you can't drink alcohol in bars. Well, we haven't done that, but we've closed indoor bars. So we've taken a lot of measures, always in consultation with our public health officials, such as Dr. Shah and others from the public health arena, and our economic advisors and our commissioners, like Jeanne Lambrew and Heather Johnson.
Thank you.
Thanks, Amy. We're going to turn next to Ed Morin at Maine Public.
Yes, good afternoon. Other states have been seeing spikes in COVID-19 cases among people in their 20s and 30s. Yeah. Figures on the CDC website indicate that almost 1/3 of cases of COVID-19 in Maine have occurred in people in their 20s and 30s. I'm wondering if the state of Maine has seen a spike in cases in that age range or whether things have been pretty consistent.
Thanks for that question, Ed. Things have been largely consistent. The average age of diagnosed cases among individuals in Maine has dipped ever so slightly in the past 2 weeks from just over 50 to just under 50. So we haven't seen the significant uptick in cases among individuals in their 20s and 30s that some of the Sun Belt states have. To be sure, we are keeping an eye on that, and I chat with our epidemiology team every single day about whether we are seeing that demographic shift. We haven't seen it yet, however, but we are on the lookout for it. And thus, what we've seen in Maine thus far has largely been consistent with where things have stood since earlier times. But I think your question, Ed, raises two really important points. The first is that this is a good reminder for young folks out there. Even though early on, much of the focus on COVID-19 was among elderly individuals, particularly those in nursing home type facilities, this is a reminder that younger folks are not immune to COVID-19. Secondly, it's all the more reason for folks to be wearing face coverings when they go out, especially younger folks. No one is immune to this virus. No location in Maine is immune to it. No age group is immune to it.
Well, let me add that on our weekly phone call with the White House and the 50 governors, or most of them, the governors of Florida and Texas noted that over half of their new positive cases, over half of those individuals were under the age of 35. Governor Abbott observed that in one county alone, 60% of the new positive cases were people under the age of 30. So it is a prevalent phenomenon. We hope to avoid it, but we hope to send the message to everybody to take appropriate precautions.
Thanks, Ed.
Can I follow up?
Sure.
Today, during the White House Coronavirus Task Force news briefing, Vice President Pence said it's very encouraging news and a good thing that half of the spikes in cases in Florida and Texas are among people under 35. The Washington Post is reporting that's because he says that young people are less susceptible to serious outcomes of the disease. I'm wondering what your thoughts are about that.
Yep. I think we know that they are carriers, as Dr. Shah just said. That's not a positive thing. The virus is non-discriminatory in terms of age. We have had serious illnesses in people under the age of 35. And those illnesses can cause physical problems for years to come. That's what we know. And young people can transmit the virus to people of any age. Maybe in Maine, 22% of Maine's population is over the age of 65. Another high percentage of Maine's population have asthma or diabetes or some degree of obesity or hypertension, all of which makes them more vulnerable, more susceptible, whatever age they may be, even if they're not among the 22% who are over 65. So Maine is taking precautions, no matter what your age is. Dr. Shah, if you want to weigh in, please.
No, Governor, I concur. One of the things we have to keep in mind is that young people don't exist on an island unto themselves. They're often coming in contact with elderly relatives or others who may have children who may have immune system issues. So even though young people may not need to be as hospitalized as often, they can transmit the virus, they can still become ill, and they can give it to others in their families and communities who may not have the same immune systems that they do. I'm going to turn next to Liz Graves at the Ellsworth American.
Hi, good afternoon. Thank you, Dr. Shah. My question is for Commissioner Lambrew. Let's see. So we have, as you know, here on Mount Desert Island, I work mostly at the Mount Desert Islander, a group of our local hospital, town managers, chambers of commerce that put together a Down East COVID-19 task force. And they created a plan for a employee testing program and also contact tracing for non-residents. So I'm wondering if you could give an update on where the project stands and the role DHHS hopes to play in that going forward.
We have welcomed our dialogue with people on Mount Desert Island as well as throughout the state. As the governor announced, we've had constructive conversations about local solutions, local ideas, knowing people who come, knowing their town layout, knowing what the risks are to their own population. Having those ideas come together in local plans has been a really exciting part of our work. Back to Mount Desert Island, we appreciate the focus that the community has, not just on making sure visitors can come safely, but making sure those people on the front lines, in hotels, at restaurants, in these tourist destinations are safe. Indeed, there is a plan that is evolving, but involves testing of some of those hospitality workers, screening, other types of contact tracing. We welcome that partnership. It's still a dialogue. I'm very optimistic that very soon we will be able to shake hands on a way to work together at the state and local level to help keep people on Mount Desert Island safe in the same way we've been doing so elsewhere.
Thank you. Can I follow up quickly? Oh, Governor Mills too.
I have to say that we've been in touch with Senator Lucchini and Representative Hubble, among others, on that issue for some number of weeks now. And I love the creativity with which they're approaching the problem.
Awesome, thank you. My follow-up for Commissioner Lambrew was that the progress of Swab and Send program more broadly. I think I gather July 1 was a goal date for some sites being set up. Could you update us on that, please?
Yeah, so we put out our application, our first request for application about 2 weeks ago today, I believe. We did a listening session last Tuesday. We heard a lot of feedback and we adjusted that request for applications so we can ensure as many organizations as possible can come in. Those adjustments include the kind of flexibility that some of our organizations in Maine sought to be able to participate. We just recently changed it, so it's a little early to tell who may come in. We're hopeful for a July 1 start date, but that's a rolling start. But as a reminder, the goal is to make sure people throughout the state of Maine have relatively quick access to a site where they can go and get a sample collected for COVID-19 testing. That sample will be sent to our lab, and the state of Maine will pay for that using federal funding that we've gotten. We are crossing our fingers that we have robust participation in this program. And I will say already, independent of this program, we do have other testing sites available. For instance, Walgreens on Forest Avenue in Portland just this week opened for testing for anybody with elevated risk, with that testing funded by the federal government. They have a special arrangement with Health and Human Services to test people out of that site. We also know that CVSs throughout the state, convenient MDs throughout the state are testing people under our standing order without a need to go to your own doctor. And we encourage people who think that they're at some sort of elevated risk of exposure to explore these options and get tested.
Thank you.
Thanks, Liz. We're going to turn next to Eric Russell at the Press Herald.
Good afternoon. My question has to do with mortality and also outbreaks at congregate care facilities. I know that we haven't seen quite as many of those outbreaks, which is really good news. And we also have seen fewer deaths over the last 20 days compared to the previous 20 days or so. And I wonder if you could say whether those two things are connected or if there's been some other positive development to keep the virus out of these congregate care facilities.
So Eric, I'll start and then invite Commissioner and the Governor to chime in. I think your supposition is generally right, that there is a connection between those two. Early on, not just in Maine, but across the country, we saw the virus start its pathway into outbreaks, starting with many long-term care facilities. Again, not just in Maine, but across the country. We learned as a public health community nationwide a number of things related to that, not just better provision of PPE, but things like cohorting patients, proactive testing of staff for COVID-19, so they didn't bring it in inadvertently before they started showing symptoms. Policies of that nature, which have been implemented now, as well as with stronger infection control practices across the board. So we've really kind of beefed up all of those things in recognition of the threat the virus plays. Thankfully, as a result of that, there have been fewer outbreaks. Those outbreaks were responsible for a fair number of the fatalities that we had in the state. So I think there is a fairly straight line that connects most of those.
And as a reminder, we did do emergency rules at the end of April that did ensure that there was infection control training at all shifts to make sure that there's a screening process for staff coming into facilities, as well as ensuring that there's a real understanding of what it takes to keep residents as well as staff safe. I think since we've issued those rules, there have been few nursing facility outbreaks. We've actually closed several of them, which is quite exciting. All that said, we have to be vigilant. Like anything else, sometimes the attention wears off. So we continue to meet weekly with nursing facilities. We continue to do our webinars on a regular basis. We continue to explore new ideas to make sure that as we go into the summer, and again, people begin to get fatigued from some of the practices that it takes, because it does take work to keep COVID-19 out of sites, that they keep up that good work. And we're doing the same with group homes, assisted living, other types of congregate living facilities, because we know the risk is similar there as well.
Mm-hmm.
Thank you.
Thanks, Eric. We're going to go to Brooke Riley at ABC 7 next.
Thank you, Dr. Shah. Can you describe a little bit to me how this funding will directly impact the average citizen in Maine?
Sure. I think Jeanne and I can obviously take that. Yeah, the average citizen and the average visitor wants to know that we're being vigilant, that we are, as a state, as a community at large, monitoring the checks and the compliance checklists and guidelines that we put out there, that every one of these businesses has signed up for and committed to, for instance. And some of the difficult areas are where in some of the streets, for instance, in Booth Bay, Bar Harbor, Algonquin, Kennebunk, Portland, you tend to see large gatherings of people. You know, we don't want people to call the police every time there's a gathering, every time somebody observes a non-compliant episode. We want there to be friendly eyes and ears on the ground. And that takes local people who know the residents, who know the businesses. And so that's what we're doing, engaging them in a cooperative effort to make sure that people have sanitation, hand sanitizers available, signage about distancing, reminders about distancing, things of that sort, indoors and outdoors. Does that answer your question? Or maybe Jeanne, Commissioner Lambrew, if you want to weigh in any respect, please.
Yeah, so I think if you think about it, what we're trying to do is really make all of our local partners extensions of the Maine CDC, on the ground, in person, people who can help provide public health education. And that takes many forms. The governor mentioned some of them. A few other examples are the city of Bangor developed its own very creative campaign to encourage people to use cloth face coverings, and we're supporting that. Some towns have, again, been handing out packets that inform people about what are the best practices for COVID-19. Others are using it for plexiglass to separate people in areas where close contact is hard to avoid. We welcome, again, the kind of creativity and public health spirit and imagination that our communities are bringing to this this activity, and we hope that this lasts far into the fall. This is really primarily a summer project, but we see COVID-19 having longer run benefits in terms of creating safer ways for us all to engage in our daily activity throughout the summer, but also beyond.
Thank you both.
Thanks, Brooke. We're going to turn next to Bob Evans at News Center.
Thank you. Governor Mills and Dr. Shah, you may want to comment as well. With phase 3 of the reopening plan taking place next week, are you confident we have, or very soon will have, enough testing to truly meet the needs of the tourist industry, considering it's apparently difficult to get tested in some other states?
Well, we're looking at those other states, and Commissioner Lambrew has been looking at that very diligently, because I've heard a few anecdotal complaints that somebody was going to make a reservation, but then they couldn't get it. They couldn't seem to find a place to get tested in Connecticut or Rhode Island or Massachusetts. And as soon as we hear that, we've gone online and found places. So we need to get the word out through the industry about where people in other states can get tested pretty readily. I talked to the governors of New Hampshire and Vermont, for instance. They have an abundance of testing facilities and sites, and their problem is they can't seem to persuade people to go get tested. I don't know why you wouldn't get tested before you travel. What's the harm? What's the fear? So we want people to know that testing is abundantly available in most other states. And as a last resort, if they can't get tested before they come, you can probably get tested when you get here, although you still have to wait for the test result and be quarantined pending the result.
Just 3 other comments I would make on that. One is that over a dozen states have the type of standing orders that we have that allow, in these other states, anybody. If you look at New Hampshire's website, it says anybody can get tested in New Hampshire. So most states, or a large number of states and a growing number of states, are expanding testing. 2, as I mentioned, here in Maine, we have a dozen and growing sites that, again, will test people at this elevated risk. So we have that access now, but that will expand. And going into the summer, we previously announced that we first tripled our testing capacity at our lab back about a month ago. Come mid-July, we expect to even quadruple that with the addition of a mobile lab, these new swab and send sites. So we will be ramping that testing capacity up in the state dramatically, partly for visitors, but also for Maine residents. Again, going back to what we heard about with Mount Desert Island, we want to make sure that our own hospitality workers have the kind of access to testing that visitors do. We want to make sure our own frontline workers who may be exposed to this infectious disease have the option of getting testing. So we're working hard on our testing capacity, in part for tourism, but also for our Maine residents.
And when you think about it, with the Canadian border closed, which is 2/3 of Maine really, if you're driving to Maine from whatever state, you're driving through New Hampshire, one place or another. I can sort of have a vision of a big testing site right next to the liquor store in Portsmouth. People would have to stop. People stop anyway. Why not get tested? No, but seriously, New Hampshire has abundant testing. There's no reason why somebody driving to Maine, inevitably driving through New Hampshire, can't find a place to get a test.
Great, thanks, Bob. We're going to turn next to Caitlin Andrews at the BDN.
Thank you, Dr. Shah. I think my question would be for you or Commissioner Lambrew. Has the state done or looked into doing any modeling, specifically looking at the COVID infection rates for racial and ethnic groups in the state?
So yes, Caitlin, the answer there is yes. Anytime we take a look at any of our current rates of disease, we always try to break them out into groups that we think may be more affected or affected in some different ways. So that has been the case with individuals of different racial and ethnic categories. What we've seen in the models closely tracks what we've seen in the actual data, which is higher infection rates, largely owing to, unfortunately, working conditions that put them in the path of the virus.
Thank you.
You bet. I'm going to turn next to David Singer at WGME.
Thank you. I have 2 questions, one for the governor, one for Dr. Shah. Governor Mills, with these applications for these grant monies, Were there conversations about what best use could be for certain municipalities, or are municipalities using them most in a certain way?
I think I can say we gave them some guidelines with the 3 categories I mentioned in my remarks. 1, public education. Secondly, public health support, including physical distancing. And thirdly, local business assistance. Now, the business assistance in Kittery may be quite different from the business assistance in Brewer, for instance. But we invited these towns and welcomed their ideas, knowing what they know about their people, about their residents, about the anticipated number of visitors, and about the businesses and what their needs are. We invited them to be creative and make their own suggestions. It wasn't a top-down kind of thing. We let them make proposals to us. And this is the result, 96 towns and cities with all different kinds of proposals. I'm excited about that.
One more question for Dr. Shah. As you're looking at what's going on in the country, particularly today in Florida and Texas and states that are doing better relatively by comparison, like New York, what are you gleaning from what's going on in these states that can be learned here from Maine?
Sure. So, David, a couple of observations. The first is on a per capita rate of new infections, there's not many states that are in a better position than Maine is right now. Even states like New York, keep in mind they were at one point leading the number of new daily infections, and now are on the other side of that wave. Maine never really experienced that. What we've learned from other states, particularly the states down in the Sun Belt that are now looking at reclosing. I think what we've learned and what I've learned personally is the dangers of moving too quickly. I think that's one reason why our moves to limit indoor bar service, to move more slowly with respect to outdoor activities, especially around dining, any other situation where congregation can occur. I think what we saw in those other states is a test case or a set of test cases in terms of what can happen if you move too quickly. So that, for me, reinforces the scientific basis for the decisions that we've made here and that the governor put into her executive orders.
Thank you.
I'm going to turn next to Megan at WMTW. Megan?
Thanks for taking my question. We've talked at length about the racial disparities in COVID-19 and some of the steps that the state is taking to try and mitigate that. I did want to also address, however, that yesterday a group of immigrant and African-American community leaders got together to call on you, Governor Mills, and I guess the entire administration really, to do more to help these communities. And I know that there have been a number of steps taken, including expanding access to healthcare and trying to translate some of the informational materials. But is there a new push to meet with the leaders of these communities? And, where do we go from here? Because the number keeps growing despite our efforts. So what can we learn from that? And where do we go from here?
I think the percentage is growing, and that's a great concern to all of us. And that's why Dr. Shah and Commissioner Lambrew have met regularly with members and leaders of the immigrant communities, the African-American communities, and various minority populations to make sure we're doing a proper outreach. As Dr. Shah said a few minutes ago, some of this is work-related, relating to the workplaces where people have been working and congested facilities perhaps, but no, we're always open to meeting. Never shut the door on anybody. I'm happy to meet with any leaders of communities who feel they're not being heard or their needs are not being addressed adequately at this point.
And on the COVID specific front, Dr. Shah, you should fill in if I miss anything. We have, as we began to detect this challenge, really worked aggressively to, number one, ensure access to testing is still a work in progress, but that standing order I mentioned does say if you're at elevated risk, and that includes people of color, given their living and working circumstances, can get a test. We're working on making those testing sites available in their communities. We know that sometimes transportation is a challenge. We're working on that availability. We're working on ensuring that you can isolate or quarantine if you're in that circumstance. Many of these people lack the ability to do that. So we've worked on hotels and other living arrangements to make sure that if these individuals do contract COVID-19, they can take care of themselves, take care of their families, and worked on social supports, food, other types of supports that allow them to maintain that isolation or quarantine. We recognize that we ourselves are often not the best messengers, so we are aggressively trying to engage these communities themselves, giving them the support, giving them the resources to be those sorts of ambassadors to these individuals to ensure that they feel as though they have the support that they need. But it's a work in progress. We are doing our best. We know we have more to do, and it is a top priority for the Department of Health and Human Services.
Thank you, Megan. I'm going to turn next to Brian Sullivan at WABI.
Thank you, Dr. Shah. I have a question for Governor Mills. Governor, I'm not sure if you're aware, but there are some pictures on social media that appear to show you making a visit to the coast. I believe it was Stonington, and posing for some pictures, or you don't appear to be wearing a face covering. Could you just give us some clarity about what was going on there?
I visited Stonington for a short time. I stopped to buy an ice cream cone, and a young lady wanted a picture with me. I always have a mask on me. I was not expecting, there's no congestion, no gathering of the public or anything like that. I've rarely been out in public at all in the last 100 days, to be honest. Yes, I did take my mask off for 2 seconds while a relative took a picture of her and me. About it.
Thank you. Dr. Shah, I have one quick question for you. This actually comes to us from a viewer. Of all the positive tests that you have conducted as you've gone through contact tracing, can you find any, evidence that the people who have tested positive were or were not socially distancing or wearing face coverings as you've gone through this process?
It's a good question, Brian. That's one of the questions that we think about as we go through contact tracing for any type of disease, is to try to get a sense of the risk factors or the protective factors that a particular individual may have had that could have put them in the way of the virus. Right now, we haven't seen any specific trend about individuals who were wearing face coverings versus who weren't. But let me be very clear about that. That's largely because not all of the data are in yet. The question you ask is the right one. It's a good one, but it's the type of question that's difficult to answer in the moment. It's really one of those questions that epidemiologists look back on and take a retrospective look on after all the data are in. So right now, it's not a question that we don't know whether, the question is not whether we think masks are helpful or not. The question is, do we have all of the data in order to demonstrate that even more scientifically? With respect to the number of cases in Maine, not all the data are in yet, and they won't be until well after the outbreak is over. But what we know from numerous other types of studies that look at the way that the aerosol particles that come out of our mouths when we talk or sing, and the way that face coverings can block those, study after study after study has demonstrated that a simple face covering, not even a fancy surgical mask, but a simple face covering can greatly reduce the spread of those aerosol particles that naturally come out. Those are the same particles that we know transmit the virus. So the science with respect to the way in which face coverings can protect you and everyone around you is quite strong. All the more reason I really urge everyone to wear a mask as they're going out. And the last question for the afternoon goes to Patrick Whittle from the AP.
Thank you very much, Dr. Shah. My question is for Governor Mills. Yesterday, the leaders in the Black community held a presser to talk about the disparity that their community has experienced, as we were talking about earlier. I would like to know if you watched it, if you've spoken with any of the people who participated in it, and also if you have any thoughts about their specific requests about using more of the CARES Act money to help Black communities.
Patrick, I did not watch the press conference. From the press reports, there are a number of people I know who are participating, and I have talked with them in the past. And members of my staff have talked with various members of that press conference, people who participated in that press conference about a number of different things over time. I'm sorry, what was you're fine. Your last question was?
Oh yeah, sorry. Yeah, the last and the last question is the one that's not yes, no. So I'll restate that. They're specific.
You asked
one of the specific points was about the CARES Act money. They wanted to know if the CARES Act money can be used to bolster infrastructure and health in Black communities in Maine. And I would love to know what you have to say about that.
I don't know what the specific proposal is. I'm just not sure what the specific. I don't think they've sent a specific proposal. Request for funds. Obviously, there are lots of different interests who are asking for that COVID relief money. We are trying to engage with the legislature on that money and make sure that we're in sync with the U.S. Treasury Department about how that money is supposed to be sent. If we get a specific proposal, we'll certainly look at it and consider any serious proposal.
And we are, as part of our work around contact tracing and social supports, trying to figure out how we can leverage the existing organizations that provide these services to support these community-based organizations that are ethically operated or run. So we are trying to use, and I think it's almost $1 million of the coronavirus relief fund for these social supports. Some of that, and we're hoping a significant amount of that will support some of these communities because we know they are disproportionately hard hit. We continue to look at opportunities through our DHHS programs to tackle these disparities because they are real health disparities, and we are looking for options to address them.
Yeah, so for instance, we're trying to address any language barrier issues through outreach through the CAP agencies, through Catholic Charities and other organizations who deal with immigrant communities on a regular basis. I'm not sure what other statewide organizations were involved in that effort yesterday, but we're happy to hear from them.
The Maine Immigrant Rights Coalition was one.
I'm sorry, the what?
The MERC, I think, is the anagram. The Maine Immigrant Rights Coalition. I might be getting one word wrong in the name. But yeah, they were one of the key groups involved was MERC, the Maine Immigrant Rights Coalition, and they were just sort of talking about how the history of the communities being underserved has left them in a position where they're more susceptible to the virus. And we've seen in the data that more people in the Black community, a higher percentage of cases are among people from the Black community, and they want to know what the state can do to stop that.
Okay. Thank you.
Great. Thank you, Patrick. And Governor, that was the last question for the afternoon.
Well, that's great. Thank you very much. I hope everybody enjoys a beautiful sunny weekend. Hopefully, today's a great day, and I want to join Commissioner Lambrew and Dr. Shah in congratulating and thanking the Holton Regional Hospital and those involved in that recent episode there, which could have been a lot worse and wasn't. And I want to thank and express my deep appreciation to all the business, especially the small businesses all across the state who are reopening, who are finding new ways to do business, to attract people from out of states and to attract people from in-state. And I hope this weekend that everybody in Maine will take it, if they have time off, take the opportunity to go to another place in Maine, find a new spot you haven't explored yet. Find a new place, a campground or place you haven't been yet. Find a new mountain to climb, a new lake to swim in, a place to fish in, and enjoy this beautiful state. Thank you.
Thank you, everyone.